I have the pleasure of introducing Miss Janet Peterson Payne today. So Miss Payne has quite an extensive background, and we're honored to have her come talk to us. So she was born in High Point, North Carolina, and at a young age, she experienced desegregation, which sparked a lifelong commitment within her to strive towards equity and social justice. For college, she went to Bennett College, where she graduated with honors. And if I'm not mistaken, I believe that is an all-girls school in North Carolina.
Correct.
All right. And she then came to Atlanta, where she completed graduate studies at Atlanta University. So Ms. Payne has a background in social services. She began her career in that field, where she focused on community needs and emphasized fair access. She also worked with Delta Airlines. No, she was not a flight attendant, but she worked for over 30 years in management, and she was honored for her service with Delta's top awards, including the Directors Award and the Chairman's Club Award. Ms. Payne also has a dedicated career with advocacy, long-term care advocacy in particular. She worked as a long-term care ombudsman in Georgia, where she fought to safeguard residents' rights who were in long-term care facilities. And her current role, she is a certified Medicare counselor for Georgia under SHIP in the Division of Aging Services. So, with that, I would like to introduce, and I should let me not forget most of all, Miss Payne is happily married. She's a mother of four adult children, and she's deeply dedicated to serving her community and advocating for vulnerable populations. So everyone, let's put our hands together and welcome Miss Janet Peterson Payne.
Well, good afternoon, everyone. Can you hear me? This is a test. Can you hear me okay?
Yes, ma'am.
All right. We're going to move forward. And thank you, Dr. Trauma, for that introduction. Sometimes I would have to wonder, are they really talking about me? But I certainly appreciate those kind words. Moving on to making sure that everyone can see my screen. Can everyone see it?
No, ma'am, not yet.
Yeah, not yet. Okay, let me and now, did anything come up?
Yes, ma'am, we're good to go.
All right. Wonderful. That's the benefits of practice. But anyway, I work for the Georgia SHIP program, and SHIP is the State Health Insurance Information Program. I'm not going to spend a lot of time on this other than to say that we are the only one sanctioned by the government to give free, unbiased, factual Medicare information. We are Georgia SHIP, but there's South Carolina SHIP, there's California SHIP, there's New York SHIP, there's Florida SHIP. The SHIP counselor available in SHIP program available to everyone in this country on Medicare by law. We don't sell anything, and we pride ourselves in not selling anything because the only thing on our agenda is to help Medicare beneficiaries understand what their Medicare options are. I'm going to move through the slides pretty swiftly because I see that I have anywhere from 15 to 20 minutes. But certainly, are we going to have questions put in the chat? How are we going to manage that?
Yes, ma'am, there will be less
All
in
right.
the chat and we'll have a
Oh,
dedicated.
okay. All right. Okay. So, moving right on along. But SHIP, we help Medicare beneficiaries understand their Medicare options. And I know you have heard that Medicare is confusing. Well, hopefully by the end of this presentation, it will be less confusing to you. But we help with understanding options, appeals, grievances, financial assistance programs, and fraud and scams. And this is the season that the Medicare fraud attempts are creeping up. So please be careful in not exposing your Medicare number. If anyone calls you, just hang up and then call the number back. And that's the way we can catch most of our scammers, because tell them, let me hang up and call your number back. And we can prevent most of our scams simply by doing that best practice. This is our service area. Georgia SHIP is all over the state, but these are our counties. We have a 10 county service areas, and you'll see those on your screen. But there's a SHIP counselor available all over the state of Georgia, but these are our 10 counties that our particular program is responsible for. What is Medicare? Everyone has seen this beautiful red, white, and blue card, and it should have a combination of letters and numbers. If you have a Medicare card that has your Social Security number on it, please tear it up. That is an old card. And in 2019, the government switched to the new card. But Medicare is for those individuals 65 and older or under 65 with certain disabilities. Now, and we are managed through Social Security and the Centers for Medicare and Medicare Services. Now, original Medicare. And hot off the press, I have information on our 2025 Medicare costs. It just came up today, and we are going to be discussing those cost increase for 2025. I wish I could say cost decrease for 2025, but I can't say that. It is an increase, but there have been certain benefits to beneficiaries afforded to us through the Inflation Reduction Act. But there are two main Medicare coverage choices. And please look at this very carefully, because you only have one of two choices. You can live under the umbrella of option one, where you have Medicare Part A, Part B, Part D. Everything is separate. Medicare pays 80%, and we're the beneficiary. We pay 20%. But then there is an option only available if you're on the option one to pay that Medicare 20% that Medicare does not cover. And that's through the Medigap plans. And we'll talk about that a little bit later on. But that basically the Medigap plans are sold by private companies, and they pay that 20% at various levels. They pay that 20% that Medicare does not pay. So you can live under the umbrella of option one, or you can jump to the other side and live under the umbrella of Medicare Advantage Part C. And that's that big umbrella where all of those Medicare Advantage plans live. Humana and WellCare and Sondacare and Cigna and Kaiser, the list goes on and on and on. But that's where all of those Medicare Advantage plans live. So you can only choose your Medicare, one of two options, either option one, your original Medicare, or option two, Medicare Part C, one of those Medicare Advantage plans. And they vary. Hospital, semi-private rooms, your meals when you go in Part A, that's your Medicare hospital coverage. And I like this slide because basically this slide shows what is not covered. Because when you enter the hospital, you are admitted, and what is not covered is private duty nursing, private rooms, because Medicare pays for semi-private rooms. All of those televisions and telephones in your room, your personal care items, that is not covered by Medicare Part A, although you are in the hospital. And one thing I want you to be aware of, so many times we enter the hospital through the emergency room. We go in there and we say we're having a pain or having some type of medical episode. So we go to the hospital in the emergency room. So sometimes there's a there's a period of time that the doctors are trying to figure out what's going on with us. Why do we have those pains? Why do we have those symptoms? Make sure, because Medicare covers admittance, make sure that they admit you. If you're in there overnight, make sure you are admitted and not in that status of observation. Observation, Medicare does not pay for observation. So make sure they admit you to the hospital. And sometimes you have to push the button for them to admit you, because you don't want to get that big fat medical bill that your Medicare has not covered if you spent the night in the hospital under observation. Medicare does not pay observation. And most people have free Part A. And if you've been contributed enough, at least 10 years, you're going to have free Part A. Now, original Medicare Part B, that covers our doctor's visits, our lab work, our chemical lab tests, our durable medical equipment, our preventive services like the flu shots and our yearly wellness visit. And I'm going to talk a little bit more about that under Medicare preventive services. Now, these I'm going to just emphasize those last two bullet points on the right-hand side under preventive services. We have, and all these services on this list are free, but basically they are screenings. We're happy to say that all of the major vaccinations and immunizations have covered by Medicare. Our flu shots, our COVID shots, our pneumonia shots, and RSVP and shingles. All of those immunizations are covered by Medicare. And the big question, because we hear a lot of push about getting the RSV vaccine, and that is covered by Medicare. But you have your welcome to Medicare preventive visit and your annual wellness visit. This is not a checkup like back in the old days, the annual checkup, the annual physical exam. That is not what this is. They're going to ask you questions about how you're feeling. Have you been depressed? Are you sleeping? Do you exercise? Have you taken used any recreational medical drugs, those kinds of things. But this is just a screening. If you are in there and you get a bill, what the doctor observes may be something necessary for some lab work, and you will have to pay your portion of the lab work if it results as a result of that wellness visit. These are the preventive visits I was telling you about, your height, your body, your education, your lab work. At the bottom of this slide, it says your lab tests are not included. Your yearly wellness, I explained that. It's just a checkup to zero in on basically how are we feeling. Now, Medigap supplement insurance. Remember I said that we're talking about what I said. If you remember, that chart said option 1 on the left-hand side. You have your Medicare supplement insurance, better known as Medigap. These two terms are used synonymously. And you can only purchase a Medigap plan that covers the 20%. We're only talking about that 20%. That 20% that Medicare does not pay. 20% of $200 is one amount, 20% of $20,000 is another amount. Well, basically, if you have original Medicare and purchase a Medigap, it pays that 20% that Medicare does not cover. Now, Medigap policies. Again, I said it fills in the gaps. That's why it's called a gap, like your co-payments, your co-insurances, some of your excess charges. But there's a premium and a separate premium, and that they are sold by private companies. Now, this is the chart. Remember, we're only talking about if you have original Medicare. We're not talking about if you're under option 2 with those Medicare Advantage plans. But these Medigap plans are covered by private companies and is sold by private companies. And the only way you have a Medigap plan is if it has an alphabet attached to it. Or let's use on this particular chart that you see, let's use a Medigap G. And it's not a Medigap plan unless it has an alphabet attached to it, because that is the only way that you can tell what level of benefit you have. You can take this to the bank. You can take this to court. This is your protection, and this was created to protect the consumer. That companies just can't willy-nilly say, I'm going to sell you a Medigap plan. It has to have an alphabet attached to it. So you're going to if you choose, because it's certainly your option, to purchase a Medigap plan, it's going to be anywhere from Medigap plan A all the way over to N, because that is the only way you can tell what level of benefit you have. And these are sold by private companies. And I say that to say the importance, private companies, by law, they have to offer, if any company sells you a Medigap plan, let's say for instance, right here, Medigap G, if a company sells you a Medigap G, it can be sold by Mutual of Omaha. And but these plans are sold basically by private companies, life insurance companies. Medigap G, Mutual of Omaha sells it, Bankers Life sells it, Manhattan Life sells it, Cigna sells it. There are a lot of companies, basically life insurance companies, that sell the Medigap plans. Well, they have to offer you all of these. We use an example of column G. They have to offer you all those benefits under G. They can't say, "Oh, I'm going to sell you a Medigap G plan, but I'm not going to offer you your Part B co-insurance co-payment." Even though it says 100%, you cannot say, "I'm not going to offer you that." That's why you have the Medigap alphabets attached to each plan. And I say all that to say, since they're sold by private companies, I'd like to use the example of the Del Monte banana, that beautiful yellow Del Monte banana that Kroger sells for 47 cents a pound. It has that Del Monte sticker on it. Well, Kroger sells that Del Monte banana with the Del Monte sticker for 47 cents a pound. The Del Monte truck drops Kroger's bananas off. Kroger says, I'm gonna sell my Del Monte bananas for 47 cents a pound. Well, that same Del Monte truck drives up the street after dropping Kroger's Del Monte bananas off. They drive up the street to Publix and drop Publix Del Monte bananas off. Now, Publix chooses to sell those Del Monte bananas, for 67 cents a pound. Same Del Monte banana. The moral of the story is shop around, because they have to offer you those benefits. Shop around, because Del Monte banana is a Del Monte banana. On this, for this chart you're looking at, Medigap Plan G is a Medigap Plan G with all those benefits in that column that's offered by the companies that sell those plans. Now, I'm going to stop just for a minute, only because the Medigap, the cost of Medicare, you may need to take some notes, because we just received the information last night about the cost of Medicare, and therefore I do not have a chart, so you have to manually write it down what the Medicare costs are going to be for 2025. This year, for 2024. Medicare costs are for per month $174.70. Effective January 1, the monthly cost of Medicare would be $185 even. And that's an increase of basically $10.30. But the Medicare for 2025 is increasing from $174.70 to $185. So everyone on Medicare will be paying, generally speaking, the average $185. The deductibles have also gone up. The Part A deductibles, and we'll talk about that later. The Part A deductibles have gone up from $1,600 to $1,676. So those are the basic, and there's some other cost increase, but those are the ones that mean the most to us, because how much are we going to pay out of what comes out of our Social Security check? Or how much are we going to pay per month? But for 2025, the cost of Medicare is $185 even. Now, going on to our prescription drug coverage, covers all of our medications, and please make sure in choosing your Medicare plans, all plans do not cover medications at the same rate. And that's something that we love to do. Our organization, the SHIP office, can talk to you about what all of your medication options are, because every plan covers medications at a different rate. So it's important that you get the right prescription drug plan, Part D, when you are optioning for your prescription drug coverage. We call it PDP. And how Part D works. To be compliant, you have to have Part A, Part B, and Part D. If you join Part D late, you're going to pay a lifetime policy. If you join Part B late, you're going to pay a lifetime penalty. And the way that works with your Part D is that you enter all of your medications into what we call a formulary. And then each plan reads that formulary, which is specific to you, because these are your medications, nobody else's medications but yours. And each plan reads your formulary for you to determine your out-of-pocket cost. And I will refer to some other changes that benefit the beneficiary as I proceed. And how am I running in time? Am I okay?
Yes,
But
ma'am.
anyway, okay. This is basically the last part because this is where the rubber meets the road. The Inflation Reduction Act, IRA, there's so much talk about the Inflation Reduction Act. The Inflation Reduction Act, probably that whole act is probably 5 inches thick. But what we're concerned about is the Medicare component of the Inflation Reduction Act. And that's where we are going to live today for this presentation and show you the benefits of what has rolled down the pipe regarding our Medicare and our prescription drugs for 2025 and moving forward through the benefits of the Inflation Reduction Act. Now, this is a timeline. This chart is very important because for 2023, what's been very important is the $35 maximum that we pay for our insulin. This has been very, very popular because, as you know, insulin costs were varying anywhere a minimum of $100 a month on up. But due to the Inflation Reduction Act, no Medicare beneficiary will pay over $35 for their insulin. And then there are penalties for those people, individuals, companies and providers that choose to hike up their prices. There are significant penalties for that. And you know where this all started? It started with the company that chose to charge exorbitant prices and an increase for the EpiPen. It was very affordable. There's no generic for the EpiPen, and that company made a decision to hike their price from about $40, $40 to $50 a month to over $400 a month, which was a hardship to so many people because they could not, there was no other option. There was no generic option for their EpiPen. And when they asked the gentleman, well, why did you do that? He said a simple answer, because I could. That was the only answer where that gentleman went to jail. But the only answer he had is because I could. Well, companies, our medication providers, they cannot do that anymore because there are significant penalties, and that is our protection. So they just can't hike the prices up for the medications. Now for 2024, extra help and extra help is through Social Security, and there's an application for extra help through the Social Security Department. That was expanded. There's no partial extra help. It's only full extra help now. And also your Part D premiums, there was a limit on how much companies could charge for that Part D premium and your out-of-pocket costs for Part D. In 2025, it continued the trend of capping out our Part D premiums. So our Part D premiums are capped, and also we pay for our Part D premiums. Now, what's going on right now, and it starts in 2026, is price negotiations. And there, my slide after this slide talks about the medications because it's a real popular conversation right now about price negotiations for medications. Now, our Part D improvements, and it's through the Inflation Reduction Act. Again, we did talk about the $35 for insulin, and access to recommended vaccines. I talked about all the vaccines now that we don't have any cost sharing part or that we are responsible for. The yearly cap of out-of-pocket prescription. This is a biggie. Out of pocket for medications, $2,000. Before it was 8,000. Now for 2025, the maximum cap is $2,000. And the expansion I mentioned earlier of extra help under the low income subsidy program. So there's no partial, people were approved for partial extra help, and now they have full extra help. Now, another big one is that all of your Part D prescription drug plans can offer you a payment plan, but you would have to contact whoever your Part D provider is, and they can spread out the cost of your medications over a 12-month period. You would have to contact the provider themselves individually to let them know that you want, if you want to do that, that you want to participate in the payment plan, wherein your payment your medication prescription can be spread out over a 12-month period. And this is a biggie for 2025. And we're excited about that component of it. So this is the drug price negotiation program, where for 2023, and we have those medications on a slide after this. For 10 basic drugs, and you could take a guess what those drugs are, but for that, that there will be a price negotiation going on right now. Now, are the pharmaceutical companies sitting down and just letting this pass? No, there's expect some lawsuits out there, expect some challenges out there, but know that Medicare, not Medicaid, Medicare is negotiating right now the 10 Part D drugs, 2025, Part 15, and the list goes on and on. And we needed this because there's so many medications that there is not a generic option for Medicare beneficiaries in these medications. And these I've told you about the 10 medications going on right now in terms of the Inflation Reduction Act and the negotiations. Now, these are those medications right now. All of the ones that we hear advertised on TV, Eliquis, Jardiance, reminds me of those people doing that group dance, that's whatever that dance is, and they're dancing all around the office, dancing down the street for Jardiance, Xarelto, Januvia, Fargasa, and Entresto, Stellaro. So these are the 10 basic medications that we were experiencing the greatest pain for. These medications were not arbitrarily selected. They were the medications that were at the top of the list in terms of the price pain that Medicare beneficiaries experience. So there is a price negotiation going on right now, and it will be effective January 1 of 2026. You will see some reductions in 2025, but everything has to be in place by 2026. And moving forward, there are going to be more medications that are under the price negotiation. Now we're going to talk about Medicare Advantage plans, and they're under Option T, Medicare Part C. And on TV, you hear a lot of things, people advertising all of the Medicare Advantage plans, and they will offer you the moon, from food cards, from transportation, from over-the-counter benefits. The list goes on and on. But I guarantee you that not one plan offers all of those benefits. Medicare Advantage plans have to offer everything that met the original Medicare. Plus, there are some extra benefits. It's to the left side of this slide. For the fourth box there checked, there are some extra benefits, and that's what we hear on TV. The food cards, the over-the-counter, the transportation, the fitness programs. Those are some of the extra benefits, but all of them are not offered by all of the plans. And you hear about a lot of people have questions about the food plan and the food card and the healthy options card. Each plan has a different name for that card, but there's a pot of money that's loaded onto this card either monthly or quarterly. And it varies from plan to plan, but most of these plans you have to be dually certified. By dually certified means that you qualify for Medicare and Medicaid. You have to be called it in the insurance industry, the lingo is dual. You have to be a dual, but you have to be qualified for both Medicare and Medicaid. And this is how the Medicare Advantage plan works. Again, you get all the rights and protections under Medicare, and the government subsidizes these companies. And most of them, you do not pay a premium. So if you have a Medicare Advantage plan, which is your Medicare Part C, and you're paying a premium, let's revisit that because there's so many plans that do not have a monthly premium. So we need to revisit that if you're paying anything for that. And what are the differences between original Medicare and Medicare Advantage? Medicare Advantage, that bundles all of those parts of Medicare together. If you have original Medicare, everything is separate. Part A, Part B, and Part D. And then on the left side, I also said that you could add supplemental coverage. But under Medicare Advantage, everything is bundled together. And a lot of people love that you can bundle everything together. Your Part A, your Part B, and your Part D. So they're bundled together. Now, remember I told you that Medicare, we were talking about what the cost of Medicare, 185 for 2025. Well, there are some financial assistance programs available. And on limited income and with limited resources. You have your Medicare savings programs, and we have information on there. There are three of them where you can save that 185. Then you have Medicaid if you qualify for Medicaid based on income and extra help. And we do have that information, and we do apply for through our office, the Medicare savings programs. And we can certainly, and it's our honor to assist you with applying for these programs. Now, this is for 2024. We have not gotten these figures for the Medicare, the income limits on the Medicare savings plans. But basically, on the left-hand side, you see individual monthly income. Now, this is to qualify for one of those programs that pay that 185 for you. And these are the minimum income limits for the qualified beneficiary. That's the first one on the left, 1275 maximum income. And then based on the program, the income requirements go up, but the benefits are different. But basically, individually, you will qualify if you do not make over $1,715 as an individual. But these are your Medicare savings programs for 2024. The programs will be there. Some of the income limits will change, I'm sure. But the minimum is $1,275 and the maximum is $1,715. So if you're under that, you can qualify for one of these programs. And you qualify through the Georgia Gateway program. Now, the next couple of slides, I'm not going to only because we can assist with that. I'm not going to spend a lot of time because this just goes over the application process for how you apply for one of the Medicare savings plans. We can assist you with it, or you can go into the gateway system and set up a gateway account. And this is the paper one. Again, your Medicare savings programs, and this is the one this is the paper one that you can apply. But again, we'll be more than glad because we can circumvent some of this paperwork by doing it online for you. And applying for Medicaid. Medicaid is state. Every state has an individual requirement for Medicaid. Medicaid is for low income. We have many people that call us and say, well, I was on Medicaid in California and I got this. this benefit. And now they in Georgia, they say that I'm not covered for this benefit. And I will say, oh, welcome to Georgia, because as you know, it's been publicized, Georgia is not one of the states that accepted their Medicaid expansion. So there are a lot of Medicaid benefits offered in other states that are not offered in the state of Georgia. And this is the extra help that I told you about that assists you with the cost of your medications. But again, our office is these slides can't include all of the information. So there are some additional programs that we can assist you with in getting assistance with your medications. And that's the Part D extra help through Social Security. Scams and fraud, I discussed a little bit about that. But basically, if anyone calls you, just hang up. Just hang up and say, is there a number where, please give me your name and number where I can call you back. If they say they can't do that, then you know it's a scam. Because Medicaid, Medicare, Social Security, they're not going to call you in the majority of the times. The majority of the times. So therefore, if someone is calling you, just hang up and say, I will call you back. And that is a best practice to pass on to everyone. And you know, hospice. Now, a big fraud going on right now are for these test programs. So be aware that they'll call you and they'll try to ask, will you participate? Can you participate in this test program? And their next question will be, please you can participate if you, and we'll send you a free gift if you give us your Medicare number. No, that's a no, that's a no, and a no.
Ms.
And
Walker,
for Medicare fraud, record your, in working with it, and record your doctor's appointments. Make sure basically that when you get your bill, that that the service dates match what you have in your record. And remember to report it. You can report it to us. You can report it directly to Medicare, because one of the things driving up our Medicare cost is the amount of fraud going on out there. So we can do our little part to try and manage the little component that we can control of Medicare fraud. And our program is managed through the Division of Aging Services. Um, and the money comes down from the federal government to offer this free program, the SHIP program, to the residents of Georgia. And I wanted to leave a little time for Q&A, because this is a season where we have a lot of questions and we love to answer questions, because each one teach one. But again, we are the State Health Insurance Assistance Program, better known as SHIP. And
thank
I'm going to
you
go
too.
to the end of this, and that is certainly you can log on to this website or access this QR code, because we want to know how we are doing. We want to know if we address, and probably would not know that until after our Q&A session, but we want to know if we provided the information to assist you in making the correct Medicare choices for you. And this is the QR code. But I want you to know that the only thing on our agenda is to help you address your Medicare concerns, issues, and questions, whether it takes one conversation or 10 conversations. Our only goal is to make sure that you understand exactly what your Medicare options are. So this ends my formal presentation. I know I rushed through a lot of it, but I wanted to, normally if we cover every slide, this presentation takes about 45 minutes. But I wanted to hit the high points to be available right now to open it up to any of the questions that you may have. So I'm going to turn it over to you, Dr. Trammell.
Thank you, Ms. Payne. We at this point we have about a minute for our questions.
Oh no.
Yeah, we were trying to make sure that we had enough time.
And Dr. Tremmel, we can do a couple minutes over, but just a couple
Okay.
minutes over to allow for a couple.
Okay, great. So one of the first questions that came in, and a lot of the participant questions are around this theme, is whether people should be concerned for any changes to the program with the incoming administration in DC?
Okay, and that is a very good question. A lot of there were a lot of political ads out there. And where the rubber meets the road, we're not attaching any validity to those concerns until we actually see something in writing. As of right now, for 2025, what I went over with you are the policies, protocols, and a cost that are associated with your Medicare benefits for 2025. Now, it's crystal balling to determine what's going to be done in 2026 moving forward. But for 2025, because all of this has to be passed by Congress and it can't be done like midstream. They can't say, oh, you've been paying 185 up until July, and then we're going to change it from that point forward. That cannot be done. And also, you have an ability to advocate for yourselves. But right now, the end result, the answer to that question is what I explained and what the slides and the information in the slides that is intact for 2025. Certainly, it is to be concerning about what things may occur and probably some changes, but we just don't know what and if there will be any changes moving forward past 2025. But 2025 is in place.
Okay. So I think that may address one of the other question is, can CMS be dissolved by Congress?
Again, so much has happened that we didn't think could happen, and it did happen. So I'm leery, because we've heard threats about EPA, Environmental Protection Agency, going away, Department of Education going away. We've heard this information, but everything is controlled by Congress. So the moral of that story is talk to your legislators. Tell them about what means the most to you in terms of your Medicare benefits, your Medicaid benefits, and your Social Security benefits. Talk to them about what means the most to you, because that's where the rubber meets the road in terms of the services for each Medicare beneficiary. And CMS, I would be leery to say that it can't, because that's a very, very strong word. But it is such a popular program, just like the Affordable Care Act. It's leaning now towards it cannot be dissolved, and we hope not. But it just remains to be seen. We're in a different political climate.
You're right. We absolutely are. Thank you. But I think it's important to remember that, all of these representatives do want to get reelected. So something along
Right.
those lines may not bode well for
Yet.
them. And
Yes. Let your voices be heard. If no other time, let your voices be heard.
So I think let's wrap it up with one more question. And does Medicare Advantage limit your ability to choose doctors and see a specialist without a referral?
Medicare Advantage has two ways you can choose it. HMO, Health Maintenance Organization, or PPO, Preferred Physician Option. If you select a Medicare Advantage PPO, then you can select your providers, your physicians. Now, where it comes in for approval is for the medically necessary component. Medicare has to determine if that procedure for if you go into a specialist is medically necessary, and that is where you would have to get the approval for that procedure, not necessarily for the doctor for that procedure. But your better chances of hanging on to the doctors that you have a relationship with, your specialists that you like, is to select a Medicare Advantage PPO, Preferred Physician Option.
Ms. Payne, thank you so very much.
And thank
And
you,
I'd
Dr.
like to
Traylor.
add, can I add that please compile a list of questions, because the questions go on, and our only agenda is to help the beneficiaries and the ones on this call. So please, if I know it may be labor intensive, but if you can gather those questions and then we can answer them, and then you can distribute to your listeners and the participants in this call that share our number that's on the screen. It would be our honor to address every one of your Medicare questions and concerns.